No more vaccines should go to countries that have already vaccinated more than 40% of their population until COVAX has the vaccines it needs to help other countries get there too. No more boosters should be administered except to immunocompromised people. Most countries with high vaccine coverage continue to ignore our call for a global moratorium on boosters at the expense of health workers and vulnerable groups in low-income countries who are still waiting for the first dose. We cannot end the pandemic without vaccines, but vaccines alone will not end the pandemic. Vaccines do not replace the need for public health and social measures. They complement them. Physical distancing, avoiding crowded spaces, masks, ventilation, hand hygiene, and other effective public health measures remain important in every country. Every country must continue to adjust and adapt its strategy.
Right now, we are seeing increases where we shouldn't be. You mentioned Europe. There's been a more than 55% increase in cases over the last 4 weeks in Europe, where there's ample supply of vaccines, where there's ample supply of tools. And, we mentioned grieving and being angry and being frustrated. What we need to see is that anger, that emotion, turned into action. We need actions that protect ourselves, that protect our loved ones from infection, from the spread. We need leaders to provide communities with consistent, accurate information, to enable communities to keep themselves safe and their loved ones safe, to invest in systems and surge those systems for surveillance, for testing, to support our health workers. It's happening now. We can't make these changes once this pandemic is over to prepare for the next one.
Very difficult to sustain the kind of effort that's needed on everyone's part, on the part of health workers, on the part of communities, on the part of government. There's exhaustion, and exhaustion is leading to complacency, and complacency is leading to gaps in our system, gaps in testing, gaps in clinical management, gaps in vaccination. And it is through those gaps that we see transmission. It is through those gaps that we see the hospitalizations and the deaths. And we need to close the gaps. We need to close the gap in vaccination. We need to close the gap in protected, safe, well-rested health workers. We need to close the gap in protecting ourselves and through public health measures, as Maria has said, wearing masks and being cautious. Just because you're vaccinated does not mean you're perfectly protected against every outcome in COVID-19. So